Well, good evening and welcome to the COVID-19 pandemic updates. I'm Kayode Okikelu. First, the highlights. The National Institute for Pharmaceutical Research and Development, NIPRID, receives 40 COVID-19 cure entries from traditional medicine practitioners. Plateau State Government targets 40 to 50% vaccination by the end of January 2022, says it continues to test aggressively. And in Europe, Germany records more than 50,000 daily infections for the first time. Well, as the holiday season approaches, the Nigeria Center for Disease Control, NCDC, is again stressing the importance of hand washing to prevent the spread of COVID-19 and other infectious diseases. Well, important hand washing moments include after coughing or sneezing, after touching high contact surfaces, upon returning home from activities outside, and when entering or leaving public spaces. Meanwhile, more positive cases have come out of 8 states and the FCT, with the most infections reported in Plateau State. Here's more on the latest COVID-19 figures and trends.
65 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT and indicate a rise from the figures reported 24 hours earlier. Plateau had the highest number of infections with 22 cases, closely followed by the FCT with 21 cases. Rivers came in with 12 cases. Bauchi had 4 cases. Lagos had 2, while Bayelsa, Edo, Jigawa, Kaduna States had 1 case each. Today's report includes backlogs of cases, recoveries and deaths from the FCT and Edo State. No cases were reported from Delta and Sokoto State. And the total caseload in Nigeria has risen to 212,894. 340 more people were discharged, bringing the total number of recoveries to 204,675. There were 8 additional deaths from COVID-19 complications reported in the last 24 hours, increasing the total number of deaths to 2,922. Currently, there are more than 5,000 active cases in Nigeria, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.7 million Nigerians have received a first shot of the COVID-19 vaccine, while over 3.1 million persons have been fully vaccinated. Globally, more than 7.3 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 220,000 deaths recorded across countries on the continent. More than 251 million people all over the world have contracted COVID-19, while deaths are over 5 million.
Exactly 20 months after Nigeria recorded its index COVID-19 case, the National Institute for Pharmaceutical Research and Development, NIPRID, has received 40 submissions of claims for COVID-19 cure from traditional medicine practitioners. The Director General of NIPRID, Dr. Obi Adigwe, who is represented by Dr. Abubakar Deranka, disclosed this at a phytomedicine training conference organized to harness and improve capacity for traditional medicine practitioners in Damaturu, the Yobe State capital. The conference will also map out ways to ensure traditional medicine practitioners produce and distribute safe herbal medicines that are effective and meet the regulatory requirements.
Since the outbreak of the coronavirus pandemic across the world, many groups and individuals, especially the traditional medicine practitioners, claimed to have discovered a cure for the disease. At this phytomedicine conference in Yobe State, the National Institute for Pharmaceutical Research and Development reveals that 3 out of 40 claims submitted have undergone clinical trials and looking promising.
In the fight against COVID specifically, we had about 40 submissions of claim by traditional medicine practitioners across the country. Such claims were forwarded to NIPRID for validation and standardization. And I can confidently say that We have seen promises in about 3 that have been so presented.
Things are being pushed further in Yobe State with the establishment of a Department of Traditional Medicine Practitioners in the Ministry of Health for easy coordination.
We are complementary. We are not in any competition with them, and that is why we are trying to see how we can collaborate all the time in order for us to have a very vibrant and healthy population in the state.
For these experts, the traditional medicine practitioners need to feel free with the system and showcase their talents for validation and standardization.
There's no any fear today. A practitioner can take his product and the product can be developed. Even if he don't have 10 kobo, there are a lot of people that are interested to invest in production of herbal medicine the moment it is certified and the efficacy is ascertained.
A lot of people that have medicines that are effective has not been harnessed. And we know that as pharmacists, most of the drugs that we use come from traditional medicine.
It is expected that this collaboration to harness the potentials of traditional medicine by the federal government with the traditional medicine practitioners would improve the health and well-being of Nigerians.
The Plateau State Health Authorities have set an ambitious target to vaccinate half of the population in the state by the new year through the various primary healthcare centers, clinics and super centers spread across the 17 local government areas of the state. For setting the targets, the State Commissioner for Health, Dr. Ndamla, also says the government is intensifying efforts towards testing more citizens. Over 87,000 samples have been tested so far, 9,866 of which have returned positive. 22 new cases have been recorded, while 51 are on admission in various health facilities across the state.
We are still doing a lot of tests. Most states are not doing testing again, but we are still doing. So far on the Plateau, we have tested 87,556 people on the Plateau. Initially, we had some resistance, but recently people are looking for the vaccine. I invited the vaccine people to my church, and surprisingly, a lot of people came on that Sunday who vaccinated over 300 people. And I think that is a good one. So people are itching and asking for vaccine. Because people have seen the importance. We told them the cells that had the vaccine, nothing happened to us. And people are being encouraged. And now that you cannot go outside this country without showing evidence of having vaccine. So people are encouraged and people are coming out. Unfortunately, the federal government is also doing well. Yesterday, they gave us over 200,000 doses of vaccine to the Plateau because our own was almost getting exhausted. We requested for more and they gave us. They brought. So we have vaccine, enough to take care of people. And the government is hoping that by the end of next year, by the end of January, we should have vaccinated 40 to 50% of our population. So they are going to bring it to almost all primary health care centers, all private clinics and government, so there will be vaccine everywhere for people to take.
Now, research is one major weapon man has deployed in combating diseases, and COVID-19 is no different. And as I speak, there are thousands of investigations and experimentations ongoing on COVID-19 at different levels. Now, you wonder just how much of that is going on in Nigeria. Well, there's a government agency taking the lead when it comes to such matters. And with a history that goes as far back as 1920, the Nigerian Institute of Medical Research, NIMR, which originally started as the West African Council of Medical Research, is tasked with that responsibility of conducting research into prevalent, communicable and non-communicable diseases. Well, the goal was to provide knowledge, treatment guidelines and recommend ways of preventing diseases. But today, The nation's foremost institute of medical research is faced with a new adversary, which is COVID-19. So let's find out the latest we know. We are joined by the Director General and the CEO of the Nigerian Institute of Medical Research, NIMR, Professor Babatunde Salako. He joins us via Zoom this evening. It's great to have you on the program, Prof. I know a lot of Nigerians are itching to know just how much we have done regarding research. So what is the latest that NIMR is involved with to contribute to the fight against COVID-19?
Thank you very much for having me. In recent times, the issues have been vaccines inadequacy and the quest for our country to vaccinate our population. And so one of the things in our front burner now is looking at fractional doses of COVID-19 vaccines. That means looking at different doses, lower than the recommended doses. This is quite necessary because we need to vaccinate our people rapidly in order to get to herd immunity level, and then of course stop transmission of the disease. However, there is vaccine nationalism. Countries who are able to produce vaccines are using it for their own population. We can't blame them. And so we must necessarily look at other opportunities where we can vaccinate our people. Recently, the Federal Ministry of Health was contacted by a group in the US, and we have been charged to look at smaller doses of 3 COVID-19 vaccines and see whether these can work as much as a standard dose. Of course, in the past, smaller doses of vaccines have been used to vaccinate people, especially in an emergency situation like this. Sometimes between 2016 and 18, the WHO actually approved that smaller doses of yellow fever vaccine was used to vaccinate people. Coming from that background, we are now looking at the smaller doses of AstraZeneca, J&J, and Moderna vaccine. We want to see if these smaller doses will be able to elicit the required immune response in individual. And if that is so, then we may be able to use, for example, 1 dose to vaccinate 2 people or 1 dose to vaccinate 4 people. That way, we will rapidly be able to vaccinate our people and then, of course, prevent further transmission of infection. Of course, there's economical gain to this because we are not going to be using a lot of money to purchase vaccine. Of course, we don't even have that money. So this is something that is very interesting to us and to government. And in the next few months, we should be coming up with what our findings are. If we're able to show that the responses are the same, then we can do a rollout in a particular section to test effectiveness of those smaller doses. That is one. And the other one we're looking at is the antibody generated by the vaccines being given to determine for how long this neutralizing antibody can stay in the body because it's been shown that some of these antibodies wane over time. And that's why some people have been talking about booster doses. And we can't even talk about booster doses because our population are yet to have the first dose or even the second dose in some situation. So we want to know when this antibody begins to wane in the body so that we can start to plan whether our population will be requiring booster doses in the next few years or thereabout. Of course, this is something that has been studied by scientists like us in other climes. For us, this is an interesting area so that we can assist government to form certain policy in relation to vaccine rollout among our population. We are also
these are certainly Pardon me, you landed that point, but these are certainly very interesting areas you have mentioned in terms of fractional doses of the vaccines, such that, I mean, you can use perhaps one vaccine for more than one person. And then the talk about booster shot. I know that came up recently. So are you saying, as it stands right now, there's no direction regarding booster shots, booster doses in Nigeria as of yet?
Well, the reason is that we have not even vaccinated a significant number of the population. So we cannot start talking about booster doses. Countries who are giving booster doses really are doing that because they can't afford it. But then the WHO is talking about equity and fair play in terms of vaccine being made available to developing countries who cannot produce their own vaccines. If less than 2-3% of Africans have been vaccinated, and yet we have other climes where they're already talking about booster doses. So where is the equity in vaccine distribution?
And
so
that's
for
quite...
us as Nigerians, we cannot talk about booster doses now.
Right. So, Prof, I mean, a lot of areas to cover on this, and it's really interesting, some of these points you have made, but there's more clearly, but we need to go on this break. And when we return, we'll explore some other areas, especially the key point of funding these research. Join us again. Welcome back. The DG and CEO of NIMR, Professor Babatunde Salako, is still with us on the program. And he's been sharing some very interesting insight into the research into COVID-19 in Nigeria. Well, Prof, thank you for staying with us. So you were going to make a third point, I mean, regarding the work that NIMR has been doing regarding COVID-19. So if you could just make that point, and then we'll dovetail into some other issues.
Yes, thank you very much. I was going to talk about the burden of the infection in different parts of Nigeria, where we're looking at antibodies amongst people who might have come in contact with the virus. And this was done for Lagos by our institution, for Sokoto, and for Delta. Now, we work in concert with the NCDC, the US CDC, the African CDC, for states like Gombe, Nasarawa, Enugu, Kano, and the Federal Capital Territory. The results from the first 4 states, Lagos, Nasarawa, Gombe, and Enugu, showed that in Lagos, we had about 23% of the population who have come in contact with COVID-19 virus and have therefore developed antibodies to the infection. And that's what's during the first wave. We've had a second wave, we've had a third now. And so it's expected that with the community infection that we have experienced, a lot more people would probably have come in contact with the virus and have developed antibodies against the disease. This level may not be enough to give us herd immunity. We need vaccine to vaccinate people to rapidly push us to that level. Perhaps because of some of the community infection that we had and the fact that a lot of people have developed antibodies, maybe it's explaining some of the ways we as Nigerians have responded to the severe infections. So we're currently looking at Sokoto and Kano FCT and Delta. The results of that will be out in the next few weeks. We are also involved in developing another diagnostic kit, which in this case will be a rapid one, because we imagine that schools may want to be testing their students. The universities have started resuming, and they may also want to test their students. So it would be a nice idea for us to come up with a rapid test that can be gotten locally, that people can use to test for COVID infection before students resume into their schools. So this is one thing that is on our front burner.
Right. So that's sort of like the lateral flow test that you have in some other countries where you could just quickly do it. But Prof, I recall that at some point we had a conversation around vaccine development, and that has been also on the front burner in recent times. And I think what I caught from your response that day was that, well, what Nigeria is focusing on right now is maybe replicating the technology that we have tried to develop our own vaccine in-house, but it didn't quite work. But just recently, there was a report about a group of scientists trying to develop a Nigerian-made vaccine. So if you could just tell us, what is the situation on that? Because just a few moments ago, we reported that NIPRID said it received, 40 claims of cure this time around, not even vaccine. So as of today, what do we have regarding vaccine? Is it production, manufacturing, or development in Nigeria?
Came together because we are interested in propagating vaccine development within our institutions in Nigeria. And we're using this COVID era as a learning curve. So we have put together a team from Uthman Danfodio University in Sokoto, the National Veterinary Institute in Jos, the Faculty of Veterinary Medicine, University of Jos, and then, of course, the Nigerian Institute of Medical Research. And we have come together to learn from each other, especially the NVRI that has been involved in development and production of animal vaccines for many years. And this has continued to date. We believe that that platform and experience could be used to launch us into how we can develop vaccines, not just COVID vaccines. Think of Lassa fever vaccine and any other infections that are ravaging Nigeria. So this team has come together and has approached through the two universities, we've approached the executive secretary of TETFund, who is listening to us, and as we speak, is looking for funds to give to this team to be able to finalize the process of training and development of vaccines in Nigeria. We do not hope to develop a COVID vaccine that we now start producing in Nigeria because we already have more than enough vaccines. And to produce vaccines, it's not a kid's glove. It's a lot of money that is involved. But we think we need a template that we can use in case we are faced with another pandemic. This essentially is what this group is all about. And of course, we hope to do a lot more with Lassa fever vaccine.
Just one more thing, Prof, as we wind down on this conversation in about a minute. I recall, I think it was about this time last week, that you launched the NIMA Foundation to fund medical research. I think the goal was 10 billion. So how much has NIMA raised? I mean, what are the priority areas regarding that? Because we can talk about research from now till tomorrow, but if there is no funding, there will be research.
Yes, we decided to register the NIMA Foundation because we discovered that government alone cannot fund research. We necessarily have to bring on board the private sector. And what happened during the COVID pandemic, I mean, the first few waves around the world showed that private sector can actually work in concert with government to support research efforts and the healthcare industry in Nigeria. We saw that with COVID, we saw that with a lot of other conglomerates, local and international in Nigeria, who supported government. And we also had a drive-through that was supported by a lot of our Nigerian companies, where we conduct tests for people in Lagos State for free. And that has been on to date since March 2020. So that experience showed us that we should approach the private sector. And the only way most private sector will be comfortable with government institutions is if it is removed from the bureaucracy of government. So we decided to follow the examples of other agencies, international agencies like the US CDC has the CDC Foundation. The South Africans have their South African Medical Research Foundation. So we thought if we follow that step, and then we get the private sector to be interested in this, and they are sure of accountability and the type of people who will be running the foundation, and we may be able to get the support so that we can assist government and assist NIMR to achieve some of its mandate.
Well, Prof, we need to run now. I just wanted to find out quickly, have you been able to raise that target, or you still have a long way to go?
We have a long way to go. That's the first launch. We are working very hard to ensure that we do another one, and we contact a lot of people who may be able to assist us to make this a reality.
Well, Prof,
jumpstarting it with whatever little amount that we have.
And we certainly wish you. We certainly wish you the very best. I know it's a lot of conversations around research in Nigeria, but good to see the work you're doing. We'd like to thank you so much, Professor Babatunde Salako, the DG of NIMR. Thank you so much for sharing your thoughts with us on the program this evening.
Thank you very much for having me.
Well, let's head outside of the country, where new coronavirus cases in Germany has topped 50,000 mark for the very first time as pressures continue to mount on the next government for more ambitious containment measures. According to Germany's public health body, the Robert Koch Institute, 235 new deaths have been recorded. Well, here's more on our global update.
Germany has recorded 50,000 new daily coronavirus infections for the first time. According to the national public health body, the country reported 50,196 new cases within the past 24 hours. The public health body also registered 235 new deaths from the virus. Some parts of the country are putting more pressure on unvaccinated citizens. From Monday, or recovery for people entering public venues such as restaurants, gyms and hairdressers. The Netherlands has recorded over 16,000 coronavirus infections in 24 hours, the highest number since the start of the pandemic. The rising number of cases is once again putting pressure on hospitals, and health experts have called on the government to impose a partial lockdown to fight the COVID-19 surge. The World Health Organization says the number of new cases in Europe rose by 7% last week and the number of deaths rose by 10%. According to the WHO report, there were about 3.1 million new cases globally, about a 1% increase from the previous week. Nearly two-thirds of the coronavirus infections, 1.9 million, were in Europe, where cases rose by 7%. The number of weekly COVID-19 deaths fell about 4% worldwide and declined in every region except Europe. The report said that countries with the highest numbers of new cases worldwide were the United States, Russia, Britain, Turkey and Germany. And finally, officials in Austria have stepped up threats of lockdown measures for unvaccinated people as new coronavirus cases in the country are soaring. Austria has taken a series of measures in recent weeks in an effort to curb the spread of COVID-19 and encourage more people to get vaccinated. On Monday, new rules took effect barring unvaccinated people who haven't recovered from an infection from restaurants, hotels, hairdressing salons and large public events.
Well, channelstv.com has more updates for you on COVID-19 and so much more, from politics to sports, business, and all that you need to know. So channelstv.com is your home for the news. Well, that's the update for today. Thank you for watching. I'm Kayode Okikelu. Just stay safe.